Kiroho mimi naomba sana ikiwezekana watutafutie mahali ya kuishi na kaburi yetu ya kujika sisi wenyewe. Hiyo ndio maombi mimi naomba sana. Kwa ugonjwa kweli mimi mgonjwa, mimi sijui anytime naweza kufa, anytime tu. Maana mimi kuna ugonjwa aina mingi kwa mwili. Niko na pressure, mimi maumivu kila aina niko nayo. Sasa mimi sijui nitafanyaje. Na kweli imenishinda mimi hata kitu kusema. Kwa hii jukumu tumepitia ndani yake. Kama tungejua hakuna hata notice, hakuna nini, si kustukia tu wanakuja bomoa bila notice. Hata leo nampa nyinyi muda wa mwezi mmoja au mwezi mbili mjipange. Hakuna watu wengi sana pamoja na watu mbalama majirani yangu wote, hakuna mtu alitoa hata tone ya sindano. Hakuna. Misikiti inaokosea nini? Kama msikiti inakosea, msikiti hana baba, hana mama, Mungu ndio baba yake, Mungu ndio mlezi. Sasa msikiti imekosea nini mpaka dakika ya mwisho mnakwenda kubomoa msikiti?
The 3,500 residents of Kibos area in Kisumu County who remained homeless after their houses were demolished by the Kenya Railways Corporation a month ago finally have something to smile about.
With enough social amenities and facilities, there is no reason why somebody living in Kibos should travel all the way to Nakuma to buy something. No, that costs time and money. So we are trying to build what we call an integrated city, integrated settlements for everybody, where facilities and amenities are available for all city residents. That's what we mean.
The residents were left helpless after their houses were demolished, exposing them to cold nights.
The idea of having slums in cities like this demonstrates human discrimination. Because really, there is no reason why anybody living in a city like this should not live in decent housing. If you go to a city like London, you'll find that there are no slums. Why should we in Africa tolerate slums? Just because we look down upon the poor. And housing from even colonial times was always provided by the state. If you go to Nairobi, areas like Kaloleni were very decent housing with plenty of space, playing grounds, social center and so on. I grew up there in the 60s with my uncle when I was going to Alliance High School. Even places like Fafa Maringo, Fafa Jerusalem, when they were built in those days, were the choice area for the middle class. So we should be able in this day and age to make sure that we do something I call urban renewal. We replace slums with decent housing.
Last month, Jamia Mosque Committee in Nairobi, in collaboration with Muslim Consortium, donated foodstuff to the victims and promised to set up a free medical camp in the area.
What guided this medical camp is the fact that there is capability in investing into permanent infrastructural development. Why? Because this land is not officially given to the residency. But I must acknowledge and appreciate the county government's effort in putting up the resettlements committee, and it is our hope and our prayer that they will expedite the process of the resettlement. Then after that, we can have further discussions on how best we can come in and invest further into permanent and infrastructural development.
The two-day medical camp benefited over 500 Kibos residents.
This is a free medical camp designed to help the people of Kibos who are afflicted by the demolitions. The idea is to assist in areas where there have been medical cases and also in the psychosocial support. As you can understand, what happened was very traumatic, and because of the trauma, we carried 3 psychologists to come and assist, especially with the children and some of our elders here.
The residents received specialized care for services ranging from eye clinic, pediatric, TB screening, gynecology, dental and counseling.
Inshallah, we will do our obstetric and gynecology clinic, we'll do a surgical clinic, we'll do a pediatric clinic, TB clinic, mental health clinic, eye clinic, dental clinic. We're trying to do what we can to the best of our ability, inshallah. We hope to treat as many as possible.
The medical camp organizers were praised by the Kisumu East Sub-County Ministry of Health official Dr. Irene Olweny, who said the efforts by the Muslim organizations have been of great benefit.
Well, right now what I'm aware is that there's a Marwa platform under NHIF, and most of the people in this camp have actually been registered under Marwa. Marwa will provide free health treatment, health management, and they can go to any facility and they will be taken care of. So when it comes to, they can be given a referral from the camp, then they can go to the nearest facility. As long as they have the Marwa card, they will definitely be treated under Marwa platform. So it will be free.
Dr. Salma Naji, a medical officer and a member of the Kenya Association of Muslim Medical Professionals, was part of the team of doctors from various regions who volunteered towards this noble cause.
We are a team of doctors, nurses, clinical officers, pharmacists, lab techs, name it, as long as you're in the medical field. I think we're about almost 30 of us who've come from different places, from MTRH. There's a team that just arrived from Moi, Eldoret. There's a team from Kisumu. There are others who we've come from Nairobi.
According to Riziki Ahmed, a clinical psychologist, there was a need to analyze the psychological and social aspects of children's overall health and their well-being.
Tulipofika hapa tumesikia watoto wakiwa katika madrasa wakisoma, na vile mama wakiongea tumejua kwamba hawa watoto pia walishtuka sana, manake waliona taa imezimwa, tia gazi katupwa, wakabomolewa, na mpaka saa hizi kukinyesha wanalalia magodoro yako na maji. Kwa hivyo watoto mpaka saa hii wamepitia pia mambo mazito. Kwa hivyo pia tunataka kukaa tufanye psychosocial support for the children, and which will be continuous. Kwa hivyo leo itakuwa ni kuanza na kufanya assessment, alafu tutaendeleza inshallah.
The psychosocial support for these kids aims at preventing and reducing the negative impact of the crisis experienced during the demolitions.
Tumekaa na jamaa wa hapa na tumeongea na wao, manake tulikuwa tunataka kuongelesha na kuoffer psychosocial support na kujua mawazo yao kisaikolojia, na kusema ukweli ni watu ambao wameumia sana. Tumeona wanalia sana, wamelia. Unaona mtu analia na uchungu. Wakieleza hiyo siku unaona kuna machungu mengi. Wanasema kuwa walivamiwa kwa njia ambayo ilikuwa ni ya kikatili, wamebomolewa nyumba zao, wamebomolewa vitu vyao, yani hawakuweza hata kutoka na vitu vyao, na wanasema hata kuna mtoto ambaye alikufa, na wakiongea unaona kweli wako na huzuni mwingi.
The residents were left devastated after an over 80-year-old mosque that was a symbol of unity was left in ruins.
Misikiti inaokosea nini? Kama misikiti inakosea, misikiti hana baba, hana mama, Mungu ndio baba yake, Mungu ndio mlezi. Sasa misikiti imekosea nini? Mpaka dakika ya mwisho mnakwenda kubomoa misikiti.
Kitu kiliwaumiza sana, wanasema ni kuona msikiti ukivunjwa, kwamba ile msikiti kuvunjwa ilikuwa ni kama jambo la kutamausha sana. Limewashtua, manake wanasema walikuwa nafikiria hiyo siku kuchukua watoto na wazee wawaeke msikitini. Sasa ile kuona pale walikuwa wataka kwenda kustiri hao watu wazima na watoto pia pamebomolewa, ikawa ni jambo la kuwakera, kuwaudhi na kuwafanya kuwa na hisia ambazo ni za huzuni sana.
Other than the psychological issues, there are concerns of an outbreak of the communicable diseases.
Our first case was an emergency referral, a kid who could not even talk because of malaria. We've just referred the patient to Jaramogi. We're seeing so many skin conditions and so many eye conditions, several eye conditions. I'm seeing the eye clinic already has a pile of patients that they've already seen. Those that we've come with a few pieces of spectacles that they're going to get for free. But those that can't, we'll see what to do after, inshallah.
The beneficiaries of the free medical camp had the opportunity to receive specialized treatment as the organizers partnered with the local hospitals where some patients were referred to.
What we have done is that right now, for now, any emergency issues, they're being handled. We have an ambulance that is on standby. And anytime we have a referral, the ambulance comes and takes the patient and to the nearest facility, the big hospital, that is Jaramogi Teaching and Referral Hospital.
Where we are trying to use local hospitals for referred cases that cannot be attended to here.
The Kibos residents are currently occupying an 18-acre piece of land allocated by the county government of Kisumu, with plans to have the land transferred to the community underway.
Our most immediate reaction was to settle people in the land available in the hands of the county. So where they are now is a county land. Let nobody tell any other story. But we said at the same time that we want to look at long-term solutions. This is a growing population. That land is not enough land to look into the future. And we said that we are going to look for a permanent settlement for the people. That doesn't mean we get rid of this settlement. There's no reason why we can't have two places. But as you know, we have a problem in this county. A lot of public land was grabbed since the Nyayo days, really. For example, there in Kibos, you find that one person who owns 40 acres. How can you hold 40 acres in the city as an individual? And then what is interesting, we found out this when we started advertising for rates collection. And somebody came to my office and said, "Look, I've been asked to pay this rate for this land. I don't know why it is." He didn't even know. He was allocated by Nyayo. He didn't know what was it. And the rate he had not paid for years. So he came to me finding out. You see, that's how ridiculous it is.
Tumekubaliana kuna baadhi ya majukumu ambayo kamati yetu inashughulikia kwa sababu za siku za usoni. Kitu ya kwanza ni kuhusiana na title deed. Ndio number 1. Title deed ya sehemu ambayo watu wetu watakuwa. Sawa iwe kama ni hapa, na tulikubaliana kama itakuwa ni hapa, ina maana ya kuwa upande wa mbele hapo ukitizama kuna fence ambayo iko. Na hiyo ni ardhi ya county government. Kwa hiyo wamesema ikiwa tutakubaliana ni hapa, itaongezwa ili at least tuwe na eka 20 kwa uchache. Kwa hiyo kazi ya kamati yetu ni kuhakikisha kuwa title deed imepatikana. Kazi ya pili ya kamati yetu ni kuhakikisha mambo ya nyumba. Watu wetu wamepata nyumba ya kisawasawa. Isiwe ni nyumba ambayo inawalaki. Pia vile vile kuangalia masuala ya barabara na maji ambayo sasa hivi tayari maji iko hapa pamoja na stima. Na tulikubaliana kuwa title deed ambayo itatolewa title deed moja ambayo itakuwa ni ya community. Kwa hiyo title deed ikishatoka, sasa wale ambao wameathirika tutakaa na kila mmoja atapewa sehemu yake, na serikali ya kaunti ya Kisumu pamoja na wahisani watashirikiana kuhakikisha kuwa manyumba zimejengwa hapa.
The processing of ownership of this land by the Nubian community. That's on course and we are progressing well with it. I don't see any problem. Yeah. So far we have not met any challenges or obstacle in the process. So the committee will issue a comprehensive statement in 2 weeks' time through the governor's office on how far we have progressed.
Kisumu County Governor Professor Anyang' Nyong'o, who has been in the forefront in ensuring the Kibos residents are relocated to a safer area, said he will fight for their rights.
The governor appointed a resettlement committee. We came, visited the ground, and also had a meeting with the committee last Wednesday. And we have divided our activities into 2, the short term and the long term. Short term is how quickly can we make this camp so human to live in. And I think we've done a lot of prevention of flooding areas, protecting and controlling water flow, putting up toilets, dome tents in case of heavy rains, and backfilling the area, which might be completed very quickly. And long term is we are going to delve into land issues so that we have a permanent ownership of the area solution. So that's our major course. Then once we finish the resettlement thing, then we do the planning for the area so that to put into a better use of an estate so that it doesn't mushroom into a slum. We'll do planning. We'll need to know their sewer system. We need to know their pathway. We need to know where they have nursery school, how big is the land, and which your compound, what kind of house will you have there?
No. Kaloleni will not be demolished. I mean, people just spread rumors. We have been working with Kaloleni for a long time. If you go to Kaloleni, you will find that it's the best infrastructure. Best roads, best drainage, best water supply, best electricity. We did that deliberately because we wanted to begin with Kaloleni in terms of urban renewal. Land there is owned by the people. People have, in fact, Kaloleni was the first place to make sure that issue of land ownership was settled, because I know the history of Kaloleni. That's the area which in colonial times was set aside for Africans. People like Jaramogi Oginga Odinga, Achieng' Oneko, B.A. Ohanga were the first people to have homes there.
Kisumu City Manager Abala Wanga noted that there has been improvements in the camp despite the notable problems arising on a daily basis.
This camp has not been so favorable. It can be showing inhuman in terms of health hazard. It has previously been flooded. We didn't have enough toilets. The places to stay were not so conducive. So night calls, and during this time of COVID, also interaction and preventive measures were a bit low. And this is a very prone malaria area. So there were all those kinds of diseases that needed to be checked out from each individual.
Let's look for permanent solution. People are engaging the county government, of course, on the issue of resettlement. There is already a resettlement committee chaired by the city manager, and we have discussed with the governor this morning, and he says they are doing all that is possible to ensure that there is some resettlement done. But I think as a Muslim community, we need to come together and see how we can engage in a structural, strategic way to ensure that the long-term needs of the people are met.
Watu wengi wanapata hapa ni kuhusu huduma, kwa sababu kuna baadhi za huduma ambazo haziko hapa karibu, kama vile kwa mfano shule ambayo watoto walikuwa wakisoma walivyokuwa kule juu sehemu za Kibos. Pia vile kuhusiana na swala la afya, pale mwanzo Red Cross waliweza kuweka kambi yao hapa na ikawa wanatoa huduma ya afya, lakini baada ya muda walikuja kuondoka. Ikawa pia county government iliweka baadhi ya watu hapa, lakini baada ya muda kaja wakaondoka. Kwa hiyo watu wakiwa wagonjwa hapa inakuwa ni changamoto, inabidi wabebe waweze kupelekwa sehemu ambayo ni hatua kidogo. Kwa hiyo hizi ni baadhi za changamoto ambazo tunazipata.
There are temporary structures that have been put in place, including a mosque that is also being used as a madrasa for the children and shelter for the elderly.
Hizi manyumba ambazo mnaziona ni nyumba ambazo zimejengwa za muda, temporary house. Na hii tumetaka tu kufanya mfano ya nyumba ya muda, kwa sababu kama vile tunavyojua kila kitu ina process yake, na huenda utaratibu ya kupata title deed huenda ikachukua muda, japokuwa tutarajia kuwa itachukua muda mrefu, lakini huenda ikachukua muda kidogo. Kwa hiyo tunasema kabla tujapata title deed hatuwezi tukajenga nyumba ambayo ni permanent. Kwa hiyo tukaamua kuwa tutajenga nyumba ambayo ni temporary. Na sasa hivi kuna baadhi ya mandugu zetu kutoka Kibira, alhamdulillah, ambao ndio wamejitolea kujenga nyumba moja. Pia kuna baadhi ya mama kutoka Kisumu ambao wamekusanya pesa, wamejenga nyumba ya pili. Na tumefanya hivyo kwa sababu hasa tukiangalia wale wamama ambao ni wazee, kuna wamama ambao ni wazee na mvua ikinyesha hapa huwa inakuwa ni shida sana, japokuwa county government imejaribu kuweka maram na kadhalika. Kwa hiyo hii ni nyumba ya familia moja ambayo ina room 3 pamoja na sitting room na jikoni.
The members of the Nubian community thanked the organizers of the free medical camp who have come to their aid during these trying moments.
I want to sincerely appreciate the teamwork that has been demonstrated ever since this problem happened to our people. We have seen people coming together, people pulling together, and like for today, the consortium of organizations that have organized this camp have made it happen, and we want to say thank you very much. Only Allah will reward your efforts. And I'm also the county malaria champion. I'm happy to hear that in this camp, issues of malaria are going to be addressed.
Salma Salim, Horizon Reports.